There's been a new breakthrough in the treatment of certain lifestyle diseases. And I saw an article about that in one of the newspapers, and they were talking about this brand new breakthrough and the positive results they are seeing with this really promising positive results coming out from various studies that they did with it. Now, to me, I'm looking at the new breakthrough, and it isn't seeming that new to me. It's actually seeming kind of obvious, and it's something that I've regularly thought and spoken about. So we're going to dive into some of that, dive into the health side. This is a health podcast for today. Well, not exactly, but you're going to see exactly what we mean there. Before we dive in all of that, if you like this kind of content, hit that like button. If you have something to say, drop a comment. Tell me what you think. Tell me what you think about this kind of content. It really does help with the algorithm. What really helps also is share this video, share it to someone, say, hey, go take in this, it's some good stuff. And maybe when they come, they could hit that like button too. All right, so this is a new breakthrough in type 2 diabetes fight with enhanced intensive lifestyle intervention. Now, diabetes is a lifestyle disease, and when it comes to lifestyle diseases, the Caribbean is in a really precarious position. We aren't doing that well. Now, for me personally, I have been one that regularly when I think about the lifestyle diseases like diabetes, etc., where a lot of it has to do with basically your diet. I mean, there are parts of it that are genetic and you don't have total control over, but a significant portion of it is your diet. I've always wondered, well, if it's a lifestyle disease, wouldn't it make sense that the person changes their lifestyle? And let's see what this new approach says. Diabetes is one of the most common chronic non-communicable diseases and has been described by health professionals as one of the most frightening scourges in the world. But there is a silver lining, as new data presented by a team of researchers from the University of the West Indies and Florida International University shows that a technique called enhanced intensive lifestyle intervention is 4 times more effective at keeping patients' blood sugar low, helping patients lose weight and belly fat, reducing their A1C concentrations, and is effective at sending diabetes into remission in a majority of patients. And that's not all. The data also shows that EILI, which includes a change in diet, exercise regime, family and therapeutic support, can effectively get nearly 90% of patients off medication within 3 to 6 months, improve their quality of life, and improve worker productivity much faster than metformin or applying exercise alone. The Caribbean EILI study, which was conducted between June 2021 and June 2022 by a team of health researchers led by Peter Neptune, followed 100 patients with type 2 diabetes who completed the 3 to 6 month program at the National Wellness Center, an NGO which focuses on delivering care for diabetes and other related lifestyle diseases. The data on the program was compared to 2 existing comparative research papers conducted in the UK and Mexico on patients using a popular diabetes drug called metformin glycinate. The study included an intensive review of the patient's lifestyle. Patients completed a questionnaire about their meals and exercise regimes. Their medication and diet was also assessed, and a diet plan and daily schedule was then developed for patients who also had access to psychological support and group therapy. Striking results show that the program recorded an average weight loss of 15 pounds over 3 months of the program, while the Mexican UK studies showed no change in patients' BMI or body mass index. The Caribbean study showed 25 basis points reduction in BMI. The study also averaged a 15 basis points reduction in A1C concentrations without the use of medication. The Caribbean study also averaged a 10 centimeter or 5 inches loss in belly size. So this seems to suggest that this new enhanced intensive lifestyle intervention, this new technique, it basically changes the person's lifestyle. So it changes their diet, it changes how they exercise, it attempts to get them in good mental state with a good support regime from family and a support structure around them. And what would you know? When a person has a healthy lifestyle, the lifestyle disease tends to go away. Who would have thought? A groundbreaking study coming right out of the West Indies here. Change your lifestyle and you may actually better your results when it comes to lifestyle diseases. Who would have thought? You see, for me, I remember in growing up, hearing when people speak about obesity. I was never one who particularly struggled with my weight in growing up. Thank you to my parents for that. At a certain stage, it's up to the parents really and truly. If you see a 5-year-old child and they're grossly overweight, that's not the child's fault. That's a wicked parent. In my book, I would consider that parent wicked. You shouldn't have your 6 you shouldn't have your child fat. That's cruelty to the child. You're starting them off at a disadvantage. But either way, I didn't have that disadvantage. I'm grateful for that. So, in growing up, I hear people talk about obesity and obesity as a disease. And I was like, it's not a disease. You're just eating too much. That's the problem. And the problem is you need to close your mouth. And as I grow older, you get some nuance in the perspective, and there are certain factors going along there. As I said, if you start off your life at a disadvantage, that's not your fault. If when you came to awareness around 5, whatever age you came to awareness at, you just suddenly came awake in this world and you already a fat little dumpling, that's not really your fault. That's on your parents. So I could understand calling some of these things a disease, because the idea of a disease is it's an unwanted negative physical state. There's a negative physiological, your body is in a negative physiological state. There's a negative physiological reaction going on in your body. You do not want that going on there, and that's what a disease is. And obesity is exactly that. Generally speaking, people who are overweight, who are grossly overweight, it's not like they want to be that way, at least usually. And the whole fat acceptance movement, I think that's evil. Those people do not like you, they hate you, they want you dead. Stay away from them. But because most people who are thinking sensibly, you don't want to be overweight. There are lots of negative health consequences coming from that. But either way, even though you don't want it and it's a disease, you get to reach to the point of treatment. And the reason why I never like to call a lot of these things diseases is because when you say diseases, some people tend to believe like the treatment for this, because it's a disease, they're thinking like it's a cold or a flu that you want to get a Panadol to treat these symptoms for. While in my book, I always figured if this thing is a lifestyle disease brought on by lifestyle choices, the way to cure this is to fix those lifestyle choices. And I don't think diabetes would be the only disease that falls into this bracket. I hope much more diseases, or almost all of the diseases could be studied with a kind of view to seeing, okay, are there negative lifestyle choices someone is making that is causing this disease to be worse presenting in their life? And if the case is that your lifestyle is creating this disease, maybe it's an unsuitable lifestyle, and you don't need to pack yourself filled with drugs, even though many pharmaceutical companies would love that. I was reading recently, they were talking about exercise, and exercising too much is a far right wing thing. Those far right racist white supremacists, they are the people that exercise too much. And then a couple days later, an article came out advertising a new drug for weight loss. So no, you don't go exercise and change your lifestyle to lose weight. You stay at home, live just as you're living, and take a drug to fix it. That seems to me to be a problem when I look out into the modern world, the modern zeitgeist. It seems like we're obsessed in the modern world about curing consequences for actions that we did, instead of changing the actions that we do. if I eat too much sugar, way too much sugar, too much processed sugar, too much carbohydrates, then it's going to store in my body as fat, and that's not a good thing. I'll get negative health consequences, health results because of that. So here's what I'm going to do. Not eat less sugar. I'm going to try to find a way to eat just as much as sugar, but stop it from being converted into fat in my body. I want to eat that sugar and then throw it back out, throw it up back out, or eat that sugar and just pass it through, instead of just eating less sugar. I was looking recently, there were people clamoring in Trinidad for a new drug that is a breakthrough drug with HIV and other STDs like that. And while I understand that it's a very useful drug, it's a drug that basically, if taken within a short period of exposure or something like that, it really decreases the chances of someone contracting the disease. And yes, it makes sense to, research all technological avenues, but in my mind I'm thinking, is that where the real focus should be, on something that is caused by an action you do? We know the action that causes the consequence. Why not focus on treating the action, teaching people eat less, exercise more, be in good spirits with the friends and family and acquaintances you have around you. These are important things for human well-being. You cannot not tick all of those boxes and then expect some magic drug to be taken and cure all for you. I don't think it's possible, but I'm sure the pharmaceutical companies would like to convince you that it is. And now we seem to have some empirical evidence with something as serious and as prominent in the Caribbean and Trinidad and Tobago as type 2 diabetes, that this is 4 times as effective as any of the drugs. One of the most effective drugs that they've been taking for this thing. Well, this new technique where we integrate everything, and they actually said that they're attempting to use less drugs, in some cases no drugs. It's about a healthy lifestyle. You change your diet, you change how you exercise, you interact good with people, you have your therapy if needed, etc. And what would you know? You lose weight, you get healthy, diabetes goes into remission. I am quite sure those won't be the only positive health outcomes, but that's my opinion. That's my view on this. I'd like to hear your view. Tell me what you think. That's all I have for now. I hope you're educated, informed, or entertained, and I will see you in the next video.